Do you know the difference between exudate and transudate? In the human body, fluids can accumulate in various cavities and tissues, a process that is not only common, but also significant in medical diagnostics. For healthcare professionals and those undergoing treatment, distinguishing between exudate and transudate is essential. This distinction aids in identifying the underlying causes of fluid accumulation, whether they stem from inflammatory conditions or systemic diseases. Let's dive deeper and explore how these two types of fluids differ. First, let's talk about what these fluids are made of and where they come from. Exudate is a complex fluid, rich in proteins, cells, and cellular debris. This viscous fluid often teems with inflammatory cells such as neutrophils, macrophages, and lymphocytes. These components are crucial as they indicate the body's response to injury or infection, actively participating in the defense and healing processes. In stark contrast, transudate is much simpler in its composition. Predominantly made up of water, this fluid also contains electrolytes and a small amount of protein. The lack of significant cellular components underscores its role not in active inflammation, but rather in mechanical fluid imbalance. Diving deeper into their origins, exudate forms as a direct response to inflammation or tissue damage. This is triggered by an increase in vascular permeability, a process heavily influenced by inflammatory mediators like cytokines and histamine. On the other hand, transudate emerges due to non-inflammatory causes. It's typically the result of an imbalance in hydrostatic and oncotic pressures within the capillaries. Common conditions leading to this imbalance include congestive heart failure, cirrhosis, and nephrotic syndrome. Understanding their composition and origin helps in diagnosing the underlying health issues. Now let's examine how these fluids look and how much of them you might find. When it comes to the volume of these fluids, exudate often takes the lead in quantity. This is primarily because the inflammatory processes that lead to its formation also promote significant leakage from blood vessels, resulting in a more substantial accumulation. On the other hand, transudate is typically found in smaller volumes. This lesser amount is due to the fluid's origin from imbalances in pressure within the circulatory system rather than active inflammation. Moving to appearances, exudate showcases a variety in its presentation. It can appear clear in some cases, but it can also be cloudy, serous, purulent, or even bloody, depending on the specifics of the underlying condition. Contrastingly, transudate maintains a more consistent look. It's usually a clear, straw-colored fluid, reflecting its less complex content and non-inflammatory nature. These characteristics are key to distinguishing between the two at a glance. So why does distinguishing between exudate and transudate matter in clinical practice? When it comes to medical diagnostics, the distinction between exudate and transudate is pivotal. Exudate, rich in proteins and inflammatory cells, signals the presence of an underlying inflammatory or infectious process. Conditions such as pneumonia, rheumatoid arthritis, or appendicitis could manifest through the accumulation of exudate. This type of fluid is often a direct result of increased vascular permeability brought on by inflammation, which allows larger molecules and cells to pass through vessel walls. On the other hand, transudate is generally associated with systemic conditions that alter the pressure dynamics within capillaries. Common causes include congestive heart failure, liver cirrhosis, or nephrotic syndrome. This fluid is typically clear and straw-colored, indicating a lack of cellular content and lower protein concentration, which points to a non-inflammatory origin. The treatment strategies for these fluid accumulations also differ markedly. For exudate, the focus is on treating the underlying cause of inflammation or infection. This could involve antibiotics for bacterial infections or anti-inflammatory medications for diseases like arthritis. In some cases, direct drainage of the fluid may be necessary to relieve symptoms and prevent complications. In contrast, managing transudate revolves around addressing the root systemic condition that leads to fluid imbalance. For heart failure, this might mean using medications that improve heart function or diuretics to reduce fluid overload. Similarly, treatments for liver or kidney diseases aim to restore the normal balance of pressures and prevent fluid accumulation. Correctly identifying these fluids can significantly influence patient management strategies. To sum up, the differences between exudate and transudate are not just academic. Exudate, rich in proteins, cells, and cellular debris, forms due to inflammation or tissue damage and often signals an ongoing inflammatory process. In contrast, Transudate, with its low protein content and lack of inflammatory cells, arises from non-inflammatory issues like imbalances in hydrostatic and oncotic pressures, often seen in conditions such as heart failure or liver disease. The volume and appearance of these fluids are also telling. Exudate is generally more voluminous and can appear cloudy or bloody, while Transudate is usually a clear, straw-colored fluid. Understanding these distinctions is pivotal in clinical settings. The presence of Exudate might prompt immediate therapeutic interventions targeting the underlying cause, such as infection or inflammation, whereas managing Transudate focuses on the long-term treatment of chronic conditions like cirrhosis or nephrotic syndrome. Grasping these differences enhances diagnostic accuracy and aids in crafting precise treatment plans. If you found this information useful, consider subscribing for more insightful content. Stay curious and informed. Yes, and